Good morning to all. Today's class is Cranial Nerve 11. What are the contents for the class? Introduction, functional component and nuclei, course and relation, branches and distribution, applied anatomy and clinical testing of cranial nerve. Okay. So accessory nerve, that is 11th cranial nerve. Introduction, it is 11th cranial nerve. It is purely motor. It consists of two roots, cranial root and spinal root. The cranial root is accessory to vagus and fibers are distributed through the vagus nerve, that is 10th cranial nerve. And the spinal root is independent course, which is regarded as spinal accessory nerve or accessory nerve. Okay, so what are the functional components and nuclei? Functional component consists of two functional components. One is spatial visceral efferent fibers, that is SVE, and another is general somatic efferent fibers, that is GSE. Now, spatial visceral efferent fibers, efferent, that means these are motor fibers. They arise from the nucleus ambiguous, they form the cranial root, and the motor supply goes to muscles of soft palate, pharynx, and larynx. Okay, and other efferent fibers are general somatic efferent fibers, which arise from spinal nucleus of accessory nerve, which is present in the ventral horn of here upper 5 spinal segments, and they form the spinal root. Okay, these spinal the fibers via the spinal root, they supply the motor supply to sternocleidomastoid and trapezius muscle. Understood? So this is what you are seeing, the red color, that is spatial visceral efferent fibers arising from nucleus ambiguous, going to supply the soft palate, pharynx and larynx, red color. Okay, and green color, these are the general somatic efferent fibers arising from spinal nucleus of accessory nerve in the upper 5 spinal segments, and these are forming the green color, that is a spinal root, which is going to supply the sternocleidomastoid and trapezius muscle. Then what is the course of the nerve? So cranial root arise by 4 or 5 rootlets from posterolateral sulcus of medulla between olive and inferior cerebellar peduncle. Okay, the rootlets unite together to form a single trunk, runs laterally along with 9th and 10th cranial nerve to reach jugular foramen. Okay, and at the same time, a spinal root arise by number of rootlets from lateral aspect of the spinal cord, that is upper 5 cervical spinal segment. The rootlets unite to form a single trunk, ascends in vertebral canal to enter cranial cavity via foramen magnum. Now here, the spinal root leaves skull through the jugular foramen, where it fuses with the cranial root. So the combined trunk comes out of cranial cavity through the middle compartment of the jugular foramen, enclosed in the dural sheath along with vagus nerve. You can see here, so these are the fibers of the spinal root which are entering via the foramen magnum. They are going and joining with the fibers of the cranial root below the inferior ganglion of vagus nerve. Now here the fibers again separated. First they are coming out through the you can see the spinal root is coming out via the middle compartment of jugular foramen. Okay, now so as immediately coming out of the cranial cavity, the two roots, now again they are separating. The cranial root will join the vagus nerve just below its inferior ganglion. It is distributed through the branches of vagus to muscle of palate, pharynx and larynx. But spinal root will descend vertically downwards between internal jugular vein and internal carotid artery. Then the nerve will pierce sternocleidomastoid. Then the nerve pass through the muscle and emerge through its posterior border, and it leaves posterior triangle by passing deep to anterior border of trapezius. Now this spinal accessory nerve communicate with fibers of C2, C3 and C4. C2 and C3 spinal nerve carry proprioceptive fibers from sternocleidomastoid, and C3 and C4 carry the proprioceptive fibers from trapezius muscle. So you can see here the course of the fibers, you can see here the different branches of vagus nerve, and what you are seeing, this is the accessory nerve which is going behind after the crossing the sternocleidomastoid. Okay. Now what is the distribution of the nerve? The cranial root of the accessory nerve via vagus nerve and pharyngeal plexus of nerve supply all the muscles of the palate except tensor pallati and tensor tympani, because all the muscle of these palate except these two muscle, they are supplied via the cranial root of accessory nerve. Okay, but these two muscle, that is tensor pallati and tensor tympani, they are supplied by mandibular nerve, which is the nerve to medial pterygoid. Then all the muscles of pharynx except stylopharyngeus, which is supplied by glossopharyngeal nerve, and all the intrinsic muscle of larynx. Then spinal root of accessory nerve supplies the sternocleidomastoid muscle along with C2 and C3 spinal nerves, and trapezius muscle along with C3 and C4 spinal nerves. Okay, you can see here the vagus, which is going and supplying the muscle of palate, muscle of pharynx, muscle of larynx. So here you can see all the muscles of pharynx except stylopharyngeus, which is supplied by glossopharyngeal, all the muscles of palate except tensor palatini and tensor tympani, and all the intrinsic muscle of larynx, they all are supplied by the cranial root. And the spinal root is going to supply the sternocleidomastoid and trapezius. Then what is the applied anatomy? So lesion of the spinal accessory nerve, the nerve can be damaged by fracture of base of skull through the jugular foramen, or stab wounds in the neck, or during the surgical removal of cervical lymph nodes. If there is unilateral lesion of spinal nerve proximal to sternocleidomastoid, it will cause ipsilateral palsy of the sternocleidomastoid, with the result that patient is unable to tilt his head towards the ipsilateral shoulder and unable to turn his face towards the opposite side. And if there is paralysis of trapezius, with the result that patient is unable to shrug his shoulder against the resistance. Then what is spasmodic torticollis? It results from irritative central lesion of spinal accessory nerve. It is characterized by chronic spasm of sternocleidomastoid muscle. Then what is the clinical testing of spinal accessory nerve? So for sternocleidomastoid, patient is asked to turn his face to opposite side against resistance offered by the examiner hand, and in normal condition a person can do it, and sternocleidomastoid will be very much prominent. Then trapezius muscle, patient is asked to shrug his shoulder against resistance. Okay, so thank you. So this is the today's class. Fine.